There's been a new checklist made for parents to do before sending their kids to school, and it's removed several symptoms that have been there all along. It says students can stay home if they have fever, chills, cough, etc. But if a child has a sore throat, a headache, fatigue, or a runny nose, they should still or could still go to school. Doesn't that go against everything we've been told for the last 6 months about not going to work or school if we're even the slightest bit sick?
Yeah, so what we have learned about a number of different things is that from the data that we have both here in BC but also across Canada and from places around the world is that those symptoms by themselves, so that's the key thing. If you have a slight runny nose by itself, then that in and of itself is not a reason for a child, and we're talking about children here, to necessarily stay home from school. So those are things that parents need to make that decision. There's some things that absolutely, if you have a fever, if you have a cough, those are things where they're much more likely to be associated with something that may be transmissible to others, COVID and other things. But other symptoms by themselves are not necessarily associated with that. So that's where we have a bit of leeway, and we've modified that. And there's also advice for if you have those single symptoms that you can keep the child home for 24 hours and monitor and see how things go. Because we know that children often have very mild symptoms that are runny nose, not feeling well today, that clear up very quickly and are not indicative of COVID. So it's a balancing act to make sure that children are able to attend school as much as possible and minimizing the risk that they pose.
Shannon, do you have a follow-up?
I guess I would just say again, I feel like as a parent for months I've been hearing the same thing, especially from Minister Dix, and he used the term the slightest bit sick. And now we're being told, well, that doesn't really apply to children going to school. Isn't that confusing for parents? And what about teachers who are adults? Is it different for them?
Yeah, so it is different for adults, and absolutely. We have, as we've learned more about this virus, we need to find that balance to make sure that we are providing children with those opportunities that they need to be in the school setting. And as a parent, you'll recognize that, especially as we go into fall, there are so many things that cause children to have one symptom that have nothing to do with an infection. So it was trying to balance that, and it was learning from the evidence that we've had from other places where this has become an issue. And so we've put in a bit of a measure that allows parents and the students, if you're older, to make a judgment call around some of the minor symptoms that we know are not by themselves usually associated with COVID.
Next question is from Brenna Owen, Canadian Press.
Yeah, thank you. I'm just wondering, I was looking on some of the health authority websites where school exposures are listed, and I just wonder what exactly low risk means. You mentioned that the exposures so far at schools have been low risk. What does that mean in an indoor setting with a lot of people, students?
Yeah, so it means that somebody might have been there for a very short period of time outside wearing a mask. So those are each individual, and we've talked about this when we were talking about schools going back and the investigations that we do of every single case. So it may be that somebody didn't have any symptoms, didn't have any close contact with individuals. So even if it was indoors, they were at least a meter away, they were wearing a mask. There's an assessment that's done on every single case and every single situation. I will say that most of the school exposures are adults who are in the school setting, and we need to remember that as well. And in the first week going back, where teachers spent time together, we had some exposures there. We've also had some exposures where somebody may not have been in a classroom setting for a period of time, or in a place where it was a risky exposure, but then spent time outside of school with a small number of other students where those students may have had to stay home. So there's a variety of situations. This is what we expected, and this is why we are working so closely with schools to make sure that we can identify people quickly, minimize the periods of time that people are at risk, and that we have all those layers of protection in place.
Brenna, do you have a follow-up?
Yeah, just really quickly, also about schools, the definitions of like an exposure versus a cluster versus an outbreak. The definition of a cluster in schools kind of sounds similar to the definition of what is then an outbreak in the healthcare setting. And is that just because it's a healthcare setting where, people are either a long-term care resident or they're an inpatient?
Yeah, and we do taper it to the risk of the people as well as the risk setting itself and the things that people are doing. So a single case in a long-term care home, we manage as an outbreak, and that means we take additional steps to reduce the number of people there, to make sure that people can be separated. But unlike a school, we can't send residents in a care home somewhere else if they've been exposed. So in a school, it's a different environment, and an outbreak is when we start to see transmission between people who are perhaps in different classrooms or in different groups, where we need to take additional measures to ensure that transmission is stopped. And so it's, probable that we at some point may see an outbreak in our schools. But right now, not surprisingly, we've seen some people who have been in the school environment for short periods of time, who've then been identified as having symptoms or being a case, and we'll manage those as well.
Hi, Dr. Henry. Thanks for taking my question. You've kind of touched on this a bit, but now that we've had at least 26 exposures recorded in schools after only 1 week of classes resuming, I've been hearing from parents and teachers that are saying they're terrified that those clusters will explode into full-on outbreaks. And if that happens, what assurances can you offer that any outbreaks can be quickly contained?
Yeah, so I think the reflection that we're seeing is that we're on top of these and we're working with them. When somebody's identified, they're removed from the school. The people who've been in close contact are isolated, and we're supporting them to do that. So that's how we actively manage any case in the school, and that is what is going to help us prevent more transmission. And if an outbreak is identified, we'll manage that as well. We know how to do that now. We've seen it. We've done it in workplaces. We've done it in healthcare settings. Obviously we want to take all of the measures that we can to prevent the introduction into the school setting so that we can prevent those transmission events. And so far, I think we've been doing a good job at that. And that's reflected in the fact that we're picking up very quickly anybody who has symptoms, who turns out to have COVID in the school system. So I think we can be reassured by what we're seeing, and we are prepared, and we will continue to work closely with every single school to make sure that we're ready.
If a child tests positive for COVID and attended school, can you confirm that all classmates will not be required to be tested immediately? And can you kind of describe or explain that process?
Yeah, so anytime a child or a teacher or a staff person or a bus driver tests positive or is positive, those people who have had contact where transmission could possibly have occurred are identified by public health. So most people are not in that situation. Even if you're in a classroom with somebody who has COVID, if you're sitting at a desk and you're not close to them, you've not had close contact with them. So this investigation is how we do for every single case. So we look at who had contact with who and what they did during the day and how it was, what types of measures they had in place. Was it inside? Was it outside? Did you wear a mask? Etc. So each of those is done on an individual basis. And unless we start to see transmission within a classroom, it would be very unlikely that an entire classroom would have to self-isolate. We have had situations where adults in a school have had contact with each other in a room together, having lunch, things like that. And sometimes that we've seen that in other countries as well, where those can lead to exposure events, and that all of those people would have to self-isolate and monitor. So this is how we manage outbreaks in every setting, and we'll be doing it as well the same way in schools. So not necessarily need to be tested unless people have symptoms, and otherwise they need to self-isolate. As we know, the test is only detects when you're shedding virus. So if somebody is in the incubation period and they don't have any symptoms and they're not yet sick, even having a negative test doesn't mean that you can go back to school. It means if you've been exposed, you need to wait that full incubation period before it's safe.
My question is also about the school exposures and the public listings for that. Again, it's about VCH that has not been listing all of the school exposures that have occurred. I've been hearing that some teachers and students who are in the same cohort and in the same classroom as people who have tested positive have not been getting notified by VCH, have not been being told to self-isolate, and they're concerned about the lack of transparency that's going on there. Can you comment about that?
Sure, and I will say that if there has been any exposure events in the schools, I absolutely am sure that my colleagues in VCH are following up with the individuals who are exposed. We do know that there have been people who have tested positive, but they've not been in the school setting during their infectious period. So often that engenders quite a lot of rumors, and people aren't sure about who's been where. So I can confirm that anybody who had close contact with somebody, whether it was in a school setting or outside of a school setting, will be notified by Vancouver Coastal Health. And yes, we have had people who have been infected either through family or through social contacts outside of the school system, but have not been in school when they were infectious. So we don't consider those a school exposure.